Now, October marks Breast Cancer Awareness Month. It's a global campaign that is dedicated to spreading knowledge, encouraging early detection, and providing support to those impacted by breast cancer. Now, this year's theme encourages, or rather, it says that this year's theme is ensuring no one fights alone. And it's a powerful reminder of the importance of community, access of care, and the strength found in solidarity. Now, breast cancer remains one of the most prevalent cancers worldwide, and also here in Nigeria. The fight against it demands a unique approach due to various challenges, including limited resources, late diagnosis, and lack of awareness.
Now, today we're honored to have Dr. Oge Ilegbune, who's a medical director at Lakeshore Cancer Centre, with us to discuss how we can work towards a future where no one faces this journey alone. Dr. Oge, thank you very much. Good morning.
Thank you. Good morning.
Welcome to the program, Doctor.
Thank you.
I would like to start by you just giving us an overview of breast cancer in Nigeria. What's the stat?
All right. So thank you very much to the viewers. Let me first start off by saying that whatever stats we have is really underreported, because one of the challenges we have is poor documentation, lack of cancer registry. Data is not our strong forte at the moment, and sometimes we have to rely on the WHO, UICC extrapolation. So, but at the moment, you know, we say that it's 63 in 100,000 for across, you know, sub-Saharan Africa, of which Nigeria is also there. And every year we have at least 168,000 new cases. This is still an underestimation, because if I take the...
Sorry, 168,000 in where now? Sub-Saharan Africa or Nigeria?
In sub-Saharan Africa,
okay.
Yeah. And if I take the numbers, what we see in the clinic, in the foundation, which we have, the numbers are huge. We also know that in terms of stats, even though breast cancer is actually more prevalent in the Caucasian women, we actually die more from it in Africa, the black woman. And this has to do with the challenges which you've actually mentioned already. Right. Lack of, you know, access to care, lack of education, early detection, just confusion really all around. We don't have a very streamlined national program around cancer care. Things are changing, so maybe we can wait till another 2 years to see what the stats shows, but there's a lot of work to be done. Right.
I mean, October is all about raising awareness. Hence your pin. I don't know why I didn't bring one for me.
Exactly.
But it's perfectly fine. So October is a month for raising awareness. Can you tell us how crucial early detection is? Because you're talking about it, you know, when it comes to the fight against breast cancer.
So with early detection, what we're trying to do is to find the cancer when there's a lot that can be done, when the finances are not as huge, when the emotional burden is not as huge. And what we found is that actually if you detect cancer early, you have, in terms of cure, almost a 90%. So if you detect breast cancer at stage 0, stage 1, so there are 4 stages we tend to look at, stage 0 to stage 4, stage 4 being the most advanced. Stage 0, stage 1 is, you know, very early, contained within, so with the breast, it's contained within the breast, it hasn't spread. We know for a fact that you're looking at a 90% cure rate. So when we have patients who have early detection and they have had cure, they go about their business, you know. Life is pretty much, it's never the same, but the cure is there, quality of life, they're not troubled by a metastatic disease or even the whole idea of terminal cancer.
Have there been any developments? Sorry to jump in.
Yeah.
I mean, have there been any developments? I mean, you talked about the challenges, you know, and when it comes to a register, national register, to look at how prevalent and how underreported or under-recorded these cases of breast cancer is. So far, have there been any sort of improvement or development when it comes to issues like, you know, for outcomes for patients here in Nigeria?
With outcomes, I think it's still early. It's still a battle. But what I would say is that, so when I first moved back to the country, you had very few facilities that were actually properly looking at, not just breast cancer, but cancer as a whole. And then you had foundations, NGOs, that sort of, got together and started doing that. We didn't really have any impact from the government's end of things, but what has happened and what I've seen in the last, say, 5 years is that we have the Nigerian Cancer Society that has sort of collated everyone under this huge umbrella so that we are all sort of speaking on the same page, unified in terms of all the work we do, whether it's education, awareness, whether it's research, which increasingly is becoming a thing. And then in the last 2 years, the government has instituted NICRAT, which is a government agency that is also beginning to sort of look at cancer, breast cancer and all different cancers as a whole, and to start looking at the gaps and the challenges we have here.
Right.
So there is a lot more narrative around cancer within Nigeria, that I can say.
At least more conversations, at least.
More conversations, more implementations of things. There are lots of meetings going on. You have the Association for the Clinical and Radiation Oncologists.
Right.
This wasn't the case some years ago. And the beauty of it is that people, all these different arms are actually coming together to discuss more conferences and more seeds being sown.
Yeah. Tell us a little bit more about early detection.
Okay.
And what do you define as early detection, and what is the most basic level of checks that you want the Nigerian woman to go through?
And man, because some persons don't know
Okay,
that.
well, man.
Yeah. So we always say, cancer is not a death sentence, and it ties to the early detection, because if it's detected early, it is not a death sentence. And so back to your question, the whole narrative around early detection is the education and awareness for people to have the knowledge to know what exactly am I meant to be doing. So when I meet women, they said, okay, what should I be doing? And so it comes down to the different screening and the preventive methods. So when it comes to screening, we always encourage women, as far as you've got breasts, examine the breast. So if you're 13 and your breast came out at 13, then you should be taught how to actually examine your own breast.
Yeah.
The whole idea is just like, women, we know our faces, when there's a pimple and all that, you actually get to know your breasts. Then, as you get older, annually, you should actually go to a facility where there's a doctor or a nurse who knows how to do what we call the clinical breast examination. So annually, and the whole idea is the doctor is just buttressing what you're doing every month. So with the self-breast examination, you do it every month after your period. And then as you get older, because the breasts change, at about 40, which is what the international guidelines, states, you should then have a mammogram. A mammogram. Uncomfortable. Let's not say painful.
Okay, uncomfortable. Yeah, my pain threshold is non-existent.
Yeah,
so.
it is uncomfortable, but it's a lifesaver. And what's a mammogram? It's actually an X-ray, very low dose X-ray, which just checks. It takes a picture of your breast. Now, if you find something abnormal, if you're below 40, we always advise to use a breast ultrasound, because the younger breasts are a bit dense, so the mammogram doesn't penetrate as well. So even though the breast ultrasound is not a screening modality, it is there as a modality for breasts that are younger. So these are the things we do. And the whole idea is, if you are having regular checks, because it's the regularity, the consistency of the checks that actually dovetails into your question around early detection. What we say is every 1 to 2 years. So if you're having that, that means that if anything changes, you pick it up early.
Yeah.
And when it's picked up early, that's where we're saying, right, it's contained within, it's local.
Yeah.
So you can do whatever treatment locally. The challenge is when it's spread. It's gone to the liver, it's gone to the lungs, it's gone to the spine, it's gone to the brain. And that's the difficulty. So early detection is such an important thing, and that is why there's a lot of noise and narrative around early detection.
I mean, well, there's too much, that I want to ask. Let's also talk about after detecting it.
Yes.
One of the fears that many people have is the strenuous process, that you have to go through for treatment, and also how expensive it is.
Yes.
Are there any efforts being made to somehow, some way reduce the cost of managing?
Hey,
So,
the sigh of
Including
relief,
Lakeshore.
you just heaved.
yeah, sorry, you said, what did you say?
I just said including Lakeshore.
Including Lakeshore. So, there are several treatment modalities for breast cancer. I think most people sort of are aware of either the surgical or the chemotherapy. But actually, when you detect cancer, breast cancer, the oncologist, that's the specialist who specializes in cancer care, is able to send, sort of determine, all right, what's the stage, what's the type of the cancer, and that comes together in now saying what the treatment plan is. Right. And it varies, from person to person based on all these parameters. Now, the most common that everybody knows, is the chemotherapy, but actually you have immunotherapy, you have hormonal therapy, you have the surgery, you have radiotherapy, and they all have different costs. Now, chemotherapy, immunotherapy are very expensive, but I know that some of the pharmaceuticals, Roche and a few others, have tried to sort of, for the low to middle income countries, they've tried to bring down the cost. And bearing in mind that we don't actually have a robust insurance here. So if you are in the UK or in Canada or in the US and different parts of the world, the developed world, there is the government input. So even though you are not paying, clearly you pay your taxes, but when you go to the hospital, no one's asking you to pay. We don't have the same system here, as we all know. Right. The national insurance scheme, they're still sort of working on it. So most patients actually pay out of pocket. Now, what has happened is there's a level of subsidy for the public sector, right? But even with cancer care, it's a lot. Patients are really struggling. What has happened over the years is that's where the foundations and the NGOs have come in. So taking Lakeshore as an example, even though Lakeshore Cancer Centre, the clinic, is like a for-profit, it's a private facility. What we decided some years ago was to resurrect our dormant foundation. And in the last 2 years, the foundation has been exceedingly active, fundraising, to be able to help cover the costs of patients who can't pay. The fundraising is channeled to education and awareness, going to the communities. When you spoke earlier, you talked about community awareness. It's very important, the market, the rural area. But the other thing the foundation has done is, because cancer treatment is broad, we have selected just one part of the treatment modality, which is radiotherapy. So in the last 18 months, for instance, we have funded about 20-something patients for radiotherapy. And there are other foundations doing the same project, Pink Blue, Medicaid Foundation. And what I've found is that all the different foundations sort of select different parts because you can't do it all. Now, with the new agency that the government has put in place, NICRAT, they are looking into funding as well. They are looking into insurance. So again, I'm thinking within the next 2 years, we might see something actually happening in terms of funding.
It's very interesting that your organization is almost towing the same line as the theme for this year, which is ensuring no one fights alone.
Yes.
And in talking about that, one can only think about mental health, especially for women that have, cancer, or even individuals that have cancer, breast cancer. I can only imagine going through that going through the treatment, right? And even when getting diagnosed of it and then going through the treatment and how lonely the journey can be. I would like for you to speak on, mental health challenges that these individuals face and how societies and communities can show up as well, especially when it comes to mental health, but most importantly, stigmatization as well.
Yeah, you just said the word stigma. Whether it's stigma in all the various cultural elements or stigma because you have cancer, and there's a lack of understanding around it, which is why there's a stigma, right? It's ignorance in some ways. And going through the cancer journey, whether it's breast cancer or any other journey, is tough. What we try to do is, first of all, when the patients come into our own space, it's important how we also manage them, okay? The support we give. It's not just about the medication or the surgery. It's also about listening. I would also point out that some of those patients don't actually have the required support from family as well because of the stigma. And we've had cases where some people have come in and they say, we don't even want our family to know that we're going through this. So I think the education and awareness out there needs to be amplified. It's happening, you know, every October there's a lot going on, but I think at the national level, that should also be taken into consideration. So it's not in the hands of just the foundations. The other thing as well is we don't have a lot of mental health supports as a whole. Again, things have changed, things have improved, but we're still so far. Some of the organizations have, so for instance, at Lakeshore, we offer psychological support. We have, you know, partners that can do that, as well as the foundations, and a few others have that. But you can offer, but the women still have to break through that whole idea of reaching out to accept support. Yeah. And that is actually a major challenge that we've found, where there is some mental health support to be had, but that resistance, the stigmatization that you're actually doing that. Yeah. And in some cases, the families also need the psychological support as well. So it's still a lot. Right. It is still a lot, and I think the crux of it is education and awareness. Yeah. People need to know that, one, it's not a death sentence. Two, it's not contagious. There are lots of myths and misconceptions around breast cancer, what causes breast cancer, what the outcomes are. And I think it's a continuous conversation that needs to be had. Okay.
I also want to, I mean, I mostly like to talk about, you know, government responsibility, you know, because, you know, we spoke earlier about the Minister for Women Affairs you know, getting fired. You know, I normally would expect that these are some of the things that that ministry would take as one of its targets, you know. Yeah. If we don't have a clear plan as a Ministry of Women Affairs, at least let's say, okay, in the next 5 years we want to achieve more funding for, you know, cancer, for breast cancer.
For issues that affect women or health issues. Breast cancer is one of them, and child mortality.
Let's set that as a target, you know.
Mother mortality rate.
So would you, is that a thing, is that an expectation that you would also have from the Nigerian government, that you should set a target for maternal and infant mortality, breast cancer, cervical cancer, all of that, and, you know, set a time frame for it?
Yes, I mean, targets are very important in whatever sector, and as important in health. I also think that with the targets, especially at the government level, it's not just one ministry that should be dealing with this. I think there should be a conversation being had. You know, you've mentioned women's health, exactly.
There's a Ministry of
Health, you know, there are all sorts of ministries. Also the
primary healthcare sector, part of it as well.
You've just mentioned the primary healthcare, you know, because most patients would first be seen by a primary care, whether it's the nurse or the doctor. Yeah. And it's this sort of seamless conversation, synergy that I think, collaborative efforts that I think is still missing. You know, I can see, maybe because we are sort of behind the scenes, we can hear the narrative, we can hear, but that whole cohesion to have it done, and for them to set the targets to say, listen, you know, in the next 5 years, we do have this target with the WHO, you know, the 1970, you know, but that's really cervical, that's very specific, and that target has actually driven, it helped to drive, you know, a lot of effort, vaccination,
you know, to reduce the
exactly.
Number. But do you think that one of the reasons why there's not so much attraction or focus on you know, diseases like this and, you know, health concerns like this is simply because of the ones that are more prevalent? I'm not saying that breast cancer isn't prevalent, but when you were to compare the prevalence between, say, malaria, for example, you know, the more focus is on that. Do you think that that's the reason why you don't get that much, that cases like this, breast cancer doesn't have much focus like this?
It's difficult to say because Actually, breast cancer is huge. That's the most common cancer in Nigeria.
Yeah.
Let's even leave sub-Saharan Africa. In Nigeria, if you have 8 women here, you know, 1 in every 8 women will have breast cancer. That is the numbers. 1 in every 8 women will have breast cancer. So it's huge. And unfortunately, we're also dying from it, even when we shouldn't. So I think it's a case of the government. You know, we keep going back to the government, but I think it's the case of the government sort of prioritizing it and saying, this is a thing. I think that conversation is being had already, but there's still a long journey. And I also think the public and the private sector need to
collaboration
work,
is going to come to that.
work together. Need to work together for this to be achieved.
To really ensure that no one is left behind and no one fights.
To ensure no one is left behind.
Well, I mean, Doctor, I must say thank you. This has been quite the insightful discussion. And we do understand there's a walk today. I mean, for those who wants to join, where's it going to happen?
So there are 2 different activities going on right now. There's one, Sweet Medics in Lekki, and then Circle Mall. We're also there, Lakeshore Cancer Centre and the Foundation for Cancer Care, trying to, you know, do this, talk to people, and answer questions as well, and also promote. We have a bit of promo going on at this time, free breast examination, free, you know, different free things. So if you go to our Instagram page as well, you'll find it at LCC Cares and at Foundation for Cancer Care.
Oh, that's our CSR for today.
Yes.
Well, if you look for if you need volunteers to yap, I'm more than happy to yap for you.
All right, lovely.
This is Dr. Oge Ilegbune. She is the medical director at Lakeshore Cancer Centre. She's talking to us about breast cancer, raising awareness, as this month is the month for breast cancer awareness. And that draws the curtains for today's Wellness Central. And many thanks to everyone for joining us today, and also for joining us on Breakfast Extra, because this is where we also close the curtain and come to an end. I must say thank you so much to my co-host for today.
Welcome.
Plus my
I would like to get
husband.
one of the
we're getting one of the pins as well.
the pins, breast cancer awareness.
Okay.
I think is,
Are you changing topic from the fact that you're my you're going to
No, absolutely. I mean,
claim me.
I can get you.
no, but I
pins.
feel please, I would really appreciate it.
Yes.
You know, and I the thing that I mentioned, you know, the last question that I asked, you know, I feel it's very, very important. You know, the collaborative effort, you know, that I spoke of, you know, but I'm personally hurt that we don't seem to have those type of targets amongst, you know, primary healthcare centers, the Ministry of Health, you know, it's a Ministry of Women Affairs. Those are the type of targets that I believe that we should be setting. You know? And if we had that, yes, the WHO exists. Yeah,
right, but I mean, it's a world. But now there has to be something on the internal.
But anyway, thanks.
Hence why these conversations are to hold them accountable. We must say thank you.